Hi, I'm Dr. Jim Hatfield with Encinitas Podiatry Group. Today we're going to talk about pain in the ball of the foot. This is the area where the toe bones meet the long metatarsal bones, as you can see here. There's really three conditions involved. The first is capsulitis. This refers to the joint where the toe bones meet the long metatarsal bones, which is surrounded by a ligamentous capsule. It also can be neuroma, which is a swollen nerve at the ball of the foot, or it can be sesamoiditis, and we're going to cover all of these. Ideally, you should have equal weight bearing across the bottom of the foot. However, some people just aren't put together that way. One of their metatarsal bones may be too long, or it may be too low. This causes a pressure point, which then goes on to cause pain. Let's look at this capsulitis condition now. Again, the toe bones meet the metatarsal bone in a joint that is surrounded by a ligamentous capsule. If too much pressure is borne there, it becomes inflamed, painful, and it's referred to as capsulitis. Here's an x-ray of a fellow who came in with a number of foot problems, but his number one most painful condition was right here. Now, we draw a line from the end of the first to the fifth metatarsal, and you can see that that second metatarsal extends way beyond the line, so that when he walks and goes up on the ball of the foot, his entire body weight passes through that one spot. It is very painful and inflamed. Another problem we often see is in regards to the nerves that pass up between the long metatarsal bones. Up at this level here, they can become crimped, become swollen and inflamed. The bigger they get, the more easily they're crimped between the metatarsal bones. This is referred to as a Morton's neuroma. Neuroma means nerve tumor, but it's not a cancer type tumor. It's just a big fat swollen nerve. It's very painful when people bear weight. The other condition, the sesamoiditis, is in reference to two small bones here at the base of the big toe joint. They're attached to a muscle back here, and think of these as kind of a miniature kneecap. And there's a lot of pathology that can happen with them. They can become fractured, crushed, bear too much weight. Here's an example of a fractured sesamoid. This dark line here demonstrates a sesamoid fracture. This x-ray here is a cross-section view showing a normal sesamoid, and then this one over here shows fragments. This is a crushed sesamoid. The initial treatment for all these problems, however, is really the same. What we want to do is decrease pressure and stress passing into the specific part of the foot. And we can do that immediately with a cutout pad to eliminate the pressure. We can recommend shoes that will take the pressure off the area. We can recommend exercises, do a problem-specific orthotic, and of course if they have a tight Achilles tendon, we're going to want to lengthen the Achilles tendon. Now this is an example of some felt pads that we can apply at the initial visit to off-weight these specific areas. The shoes that you wear are really critical in eliminating the stress. As you can see, a shoe like this, not going to help at all. This shoe here, this is a New Balance 928 shoe, very stiff across the ball of the foot, and this is going to allow weight to be borne throughout the entire sole of the entire foot, not just at one specific area. The exercises that you do make a huge difference. If you do high impact exercise like running, distance walking, treadmill work, or sports like basketball or soccer, and you continue to do them, you're going to continue to have stress passing into the foot. If we can get you out of those sports at least temporarily and do non-impact exercises like, say, exercycle, elliptical trainer, bicycling, or swimming, which is a no impact at all, then your stress level is going to go down, the pain is going to subside, and then we can get you back into your sports. This is an example of a problem-specific orthotic. Again, this has the highest success rate of any of our treatments in relieving the pain, because this is a permanent thing that you can wear in all your shoes. You can transfer it from shoe to shoe, and it specifically off-weights a specific area of your foot to eliminate the pressure. This is how we make orthotics in our office. After examining the foot, we scan the shape of the foot into a computer to capture the shape. Then we can use some software tools in the program to modify it in off-weight specific areas, which will then show up as depressions to eliminate the pressure. If you have a tight Achilles tendon, it needs to be stretched out, because a tight Achilles tendon will pull up on the heel and relatively pass all the body weight into the ball of the foot. If conservative treatment fails, and it only fails maybe 10 to 15% of the time, we need to try something else. This may mean shortening a metatarsal bone. If the sesamoid bone is crushed and we just can't make it comfortable, it might need to be removed. And again, the neuroma condition is kind of lengthy, so we have a separate video on that. If you have pain in the ball of the foot, please come on down to our office. I'm sure we can do something to help you.